Hello friends, welcome back to my channel. Today I am going to discuss with you another role play that is regarding a 7 years old girl who has just had her adenoids removal. Okay, so in this role play, first is setting that is hospital ward, and then is background history, nurse. You see the parents of a 7 years old girl who has just had her adenoid removed and is due to be discharged. You see the parents to discuss his or her daughter's discharge and to answer the parents' question. His or her daughter is not present. So here the daughter is not present, but the nurse is talking with the parents. That means the role play is bystander. Okay. So now the list of tasks are there, which we'll discuss one by one. So, before that, how to start the role play like this? First, time wish that is post good morning, Sarah. In this case, the name of the bystander we already know because patient is admitted in hospital ward as well. We also know the patient's name. Okay, so suppose the patient's parent's name is Sarah and the patient name is Mary. Okay. So we can start the role play like this. Good morning, Sarah. My name is Ramangil, one of the registered nurses working in this hospital ward. Today, I'm your daughter's attending nurse. So first we can ask from the parents, how are you feeling? Then the parents reply, suppose it's mother, she say, I am fine. And then we can also ask her, how is your daughter, Mary? And she reply on behalf of her daughter, like Mary is fine. This is a known case. We can already ask the name of the patient as well as parents in the 3 minutes that we have given during preparation. Okay. So the next is when the parents say that Mary is also fine, so we can say, good to hear that, Sarah. I'm glad to inform you that Mary is ready for discharge and I am here to discuss the same with you. As we have seen from the background history, that a nurse is talking with the parents that regarding the daughter's discharge. Okay. So next, the parents is worrying regarding her discharge. Okay. So the task say first task is confirm the daughter's readiness for discharge, post operative recovery satisfactory. Find out if the parents has any concern. For example, pain management, self care after discharge, etc. So we can construct the sentence like this. Well, Sarah, the reason for Mary discharge confirmation is that her post operative recovery is very much satisfactory. There was no any complication during the time of procedure. May I know about your concern, please? As we have seen in second sentence, find out if parents have any concern. So we can ask, may I know about your concern, please? Okay. Then the parents say that her daughter is having a problem like sore throat or any speaking problem. So we can say, and next, acknowledge your concern, Sarah. I would like to let you know that there will be some after effect of adenoidectomy. So, for her, these are the quite normal and self-limiting. Some of the common after effects are sore throat and change in voice, which Mary is currently experiencing. Also, earache and stiff jaw are usual. So in the second task, we see that outline common temporary after effect of adenodectomy, that is sore throat or earache, stiff jaw, change in voice. So for this, we can construct the sentence like this. Okay. Firstly, we say the parents that we acknowledge your concern. Then we can explain that an after effect of adenoidectomy is quite normal and self-limiting, and moreover these are the like sore throat and voice change is normal and usual. Okay, so next is again the sentences give detail of recommended pain relief over the counter painkiller. Example is for paracetamol, etc. So for this we can construct the sentence like this. Now Sarah, in case Mary experiences pain, you can provide over the counter painkiller like paracetamol for the pain relief. Okay. So for this we can construct like this sentence. Okay. And next, mother is feeling good when we are explaining regarding the painkiller. So uh, we can ask, okay, that's and Mary say that's okay. I will give paracetamol to my daughter if she experiences any pain. Then nurse will reply, that's perfect. Do you have any other question for me? So like this, the patient mother have concern regarding the diet or any food, what type of food she gave to her daughter after the surgery. Okay, so then the nurse will say like three times make recommendations on food types in the meantime. Example is easy to swallow, smooth texture, non-abrasive, etc. So this is the task, and we can construct the sentence like this. Your concern is understandable. I will advise you through the dietary requirement after adenodectomy. The time scale for solid food is 3 days. Okay, so after 3 days, your daughter Mary can take solid food. By the time her wound will heal, and meanwhile, it is highly recommended to provide food type that are easy to swallow. Okay, so we can construct this sentence like this, and consider food that have a smooth texture and non-abrasive to reduce the chance of injury. Okay, so for this is the sentence. And after that, patient say like this, she need a recovery at home for 1 week. Okay, the task is advice need for recovery at home 1 week. Outline ways to reduce risk of infection. Example is avoidance of people with cough and cold, no swimming for 3 weeks, etc. Explore any other patient concern. Next step, etc. So for this we can construct the question like this, that patient's mother wants to send her daughter to school, but the nurse can say, being a mother, your thoughts are sensible. However, I am sorry to say that she needs 1 week of rest at home for recovery. Okay, nurse can reply like this. And another is the nurse can also say like this, we have read the task to avoid the risk of infection. So for this, the sentence is currently she is highly prone to get infected. Therefore, it is very essential to avoid situation that can spread infection. To avoid contact with people having cold and cough. Okay. In addition, no swimming for 3 weeks. Okay, and because swimming will if swimming will increase the chance of infection. Okay, and then apart from this, other common way to get infections are like avoidance of people with cold and cough. Okay, so we can say like this. So next is explore any other patient parents concern. Next step. Okay, so we can also ask Sarah, do you have any other concern regarding your daughter? So then she say regarding any follow up appointment. So then a nurse can clearly confirm with the parents that actually no follow up appointment is necessary for Mary's condition now. Perhaps if she developed severe symptoms such as fever, intense pain, or prolonged bleeding from mouth, then immediately seek the medical help. Okay, so because the nurse have to stress on this point as it is given in the task, stress need for the medical help if daughter develops severe symptoms. Okay, so like this we can construct this sentence. And at the last, when the role play is over, we can say, as it is a hospital ward, we can use the phrase, if you need any assistance, please press the buzzer beside your daughter's bed. I will be happy to assist you. Thank you. I hope I have cleared to you. Thank you for watching my video. Thank you once again.